Welcome to Medicmode, and this is Jabez. And last week in our Instagram page, in our Find Out Friday, we had a case discussion. So, which is there was a 59-year-old gentleman with the complaints of chest discomfort and sweating for a few hours. So, and the vitals of the victim was he was conscious oriented, by the way, and his vitals was his oxygen saturation was 98%, and his heart rate was 220 beats per minute, and his BP was 70/50. So what are you going to do? So how are you going to approach the victim? In case of it is in pre-hospital setup, always don't forget scene safety. To that we are going to do the initial assessment. We're going to check if the victim is conscious and unconscious, and if he is unconscious, check for his pulse and breathing. If he doesn't have pulse and breathing, start CPR, as you know. If he's having pulse and breathing, or if he's conscious, then go to the primary survey. In the primary survey, we're going to check for the A, B, C, Ds. We're going to check for his airway, breathing, circulation, disability, and exposure. And if the airway is not patent, consider protecting the airway and check for his breathing. And if there is any need for starting an oxygen, start an oxygen. Check for circulation. We already know some vitals of the victim, and don't forget to start an IV axis. And if there is an axis of 12 lead ECG, take in 12 lead ECG. And then after that, so always when you are doing a primary survey, check the victim, evaluate and treat. And after that, in our case, he's a tachycardic victim, and his ECG was monomorphic ventricular tachycardia. So what are you going to do? So after these steps, I'm going to check if the victim is stable or unstable. How to know the victim is stable or unstable? So we have something called H-Asia. So what is H-Asia? We're going to check if the victim is having hypotension or any altered mental status, or does he have any signs of shock, or is he having ischemic chest discomfort, and is he having any acute heart failure symptoms. In our case, the victim is having chest discomfort, and his BP is in the lower side, which is worrying. So what are you going to do? He's unstable. So the next line of treatment will be I'm going to consider synchronized cardioversion. So before starting in synchronized cardioversion, always consider sedation, because synchronized cardioversion will be a painful procedure for the victim, which the victim cannot tolerate. The recommended dose, either we can go with the manufacturer's recommendation, or you can start with 50 joules. And after syncing the victim, after giving the synchronized cardioversion, so reevaluate the victim after 3 to 5 minutes. If there is a need for the next synchronization, consider synchronization again. Meanwhile, again, to check for the underlying causes, and you can treat the underlying cause, and if needed, you can also start an antiarrhythmic drug such as amiodarone, which is initially you can start with 150 mg over 10 minutes. And then what you're going to do is you can, after that, if needed, you can start an amiodarone infusion, which is 1 mg per minute for the first 6 hours. The next thing, you can consider expert consultation. So this is for the management of tachycardia in case of the victim is unstable. If he is stable, we're going to let us know. We'll discuss it in the upcoming videos. Thank you.